Time together. Welcome to the Zooming Out. We are going to be talking today about shifting mindsets from individualism to contextualism with our friend and partner in prevention, Dr. Julie Sweetland. But first, a big thank you to everyone for joining. Together, we've been on this journey for 3 years now, I think, really trying to figure out how to lead a narrative shift in this country and really shift our efforts, really focused on primary prevention to ensure that we can reach our collective North Star, that all children and families are living a purposeful and happy life with hope for the future. So this Zooming Out series really supports our intentional efforts for adaptive learning, right? As we know better, we do better. As we learn what works, we want to do more of that, less of what doesn't work. This is a theme in all of the work that we do, especially at a time like now where our work is more important than ever to continue to support families to be strong and to be healthy and well, and to do all of that supporting before they're in crisis. So prevention can only happen in partnership. And so thankful to all of you wonderful partners in prevention that are here together with us to recognize that the power of working together to create the conditions is really critical, right? None in our individual silos can do this work alone. And in this time, we have to really shift mindsets, right? To join us in this collective effort. It's going to take all of us, all of our friends, all sectors to really make sure that families have what they need to thrive. And so research and science, of course, confirm that shifting mindsets is one of the most impactful leverage points in building a primary prevention ecosystem, which I know that you all are really aligned with. And obviously, Dr. Julie Sweetland, our friend, has helped us to lay the foundation. She's been with us, of course, before. We've done some really important work together, reframing childhood adversity, that brief, talking about race equity, another real key resource that Julie has helped work with us to develop. She's a sociolinguist, a senior advisor at the Frameworks Institute. I know her bio is long and I won't share all the great things about her, but just to say that she has really led reframing initiatives in our country on some of the most critical topics, right? Things like climate change, education equity, childhood adversity, and many more. Her skill in translating framing science and research into comms and really actionable strategy has helped advocates, policymakers, and scientists drive change at the national, state, and grassroots levels. And of course, those of you who know her know that she's also kind and funny and smart and just a wonderful partner in prevention. So we are so thrilled that today she will go deeper. She will guide us in how we shift from individual blame and shame to contextual understanding, right? Something that's, again, so important. And our collective work is stronger when we align messaging with mindsets that foster real systemic change. There will be a chance for question and answer at the end of her presentation that our Chief Strategy Officer, Jennifer Jones, will facilitate. So without further ado, welcome to our friend and partner in prevention, Dr. Julie Sweetland.
Thank you, Dr. Merrick. What a lovely introduction. It's good to be with you, and it's good to be with everyone here in a moment like this when conversations about communication need to happen in coalition. I know there are so many unsound, unsettling, and unjust things taking place in terms of children's well-being right now. I don't have answers for all of that, but I do have one big idea to offer that history shows us is an essential one. The way we frame issues now, even in a noisy or uncertain or chaotic moment, it really will affect what's possible later. And sometimes, communications interventions or framing interventions could feel like not enough when there's so many real direct harms happening. But I like to think that it's as good a place as any to start, because one of the few things we can control in a moment like this is the way we can communicate. But framing matters at all points, no matter what the political context. I'm delighted to be here from the Frameworks Institute. We're a nonprofit celebrating our 25th anniversary this year. We're a group of social scientists and social change strategists. So I'm a sociolinguist, we have sociologists and anthropologists, etc. Not your usual comms shop training. And that's because we believe that the communications aspects of social change require just as much evidence and rigor as the policy positions and the programmatic work that mission-driven organizations undertake. So we try to do that rigorous research. We do it with support often from major foundations. And then we live to our nonprofit mission by making it freely available to other mission-driven organizations, folks like you. And we work alongside storytellers, organizations, and coalitions to integrate those insights from the framing research into your ongoing social change strategies and communications. So I'm really excited to be able to share some ideas with you, because the importance of framing the public discourse is really built into the theory of change that PCA America and all of you are working towards. Before I use the word framing one more time without defining it, I'll do a quick definition. It's simply choices in how we present ideas, the process of making choices about how we present ideas. Those choices can involve where to start, what to emphasize, how to explain it, and what to leave unsaid. And the way we frame children's issues really influences how people think and feel about them, what actions they're willing or not willing to take or support. And as frames move through society, they shape what the public and policymakers pay attention to. They shape the type of response that is seen as appropriate. Is it seen as a personal, private trouble, or a public issue that deserves a public response? And so by integrating evidence-based framing into what we're talking about and the way we're talking about it, we can get very different responses to the same issues that we've been advocating for all along. One quick example, this is from this study that was some time ago. I'm going to say this might have been 10 or more years ago, but we were looking at different ways to advance public support for policies that promote early relational health, children mental health, etc. And the zero across there is the control group. That was a group that got no framing at all. They just were asked, their opinions, attitudes, and policy preferences around those policies. But some groups, some participants in this survey experiment logged on and got a message about social prosperity, that when we support children's early experiences and promoting, developing good mental health, that's the foundation for a prosperous future, civically, socially, economically. But when we talked, and then another group logged on and got a message that was about vulnerability, how vulnerable children are to the effects of trauma, poverty, hunger, at risk of abuse. We saw that those two different frames got very different effects. When people really saw that investing in children can lead to a brighter future, people were more likely to support those policies. When we doubled down on just how vulnerable, how many children can be and the risks that they face, that led people in exactly the opposite direction that I think people who message like that wanted. And this isn't because people don't care about children, right? The right frame was boosting support. Our research suggests it's because when people hear about vulnerable children, they think bad parents, right? And so that saps the kind of support for the kinds of things that we can do. So framing, I've dedicated my career to this. We've got a whole organization doing this because framing shapes mindsets, and those mindsets in turn influence the policy climate. We know that lots of mindsets are working against us, individualism being public enemy number one there. But sometimes we get in our own way too. Many of our common approaches to changing mindsets don't actually work. However, with the right framing, and we're looking at to what does work, what has been proven to really shift mindsets, we absolutely can drive change. So I'm going to spend a little bit of time on mindsets, but then most of our time together today on framing. So, um, uh, mindsets are, if you feel like I've been doing this work for a long time and I hadn't been hearing about mindsets, all of a sudden it's kind of everywhere. Why is that? It's because a lot of both social science and social change strategy has found that understanding the thinking, the deep thinking that is holds a system up can be key to shifting that system. So this diagram is from our friends at the Social Change Consultancy, FSG. It talks about different conditions of social change. It's not meant to suggest that any one of these is more important than the other, but rather that sometimes things are more or less visible to us as we're thinking about social change. And they point out that the mental models, the patterns of thinking that people have about an issue really shape the decisions that they make. Doesn't mean those mental models are always wrong or bad, but they have effects. So I like to talk about the mental model of consumerism, which is just the model that in our society, we get things through a process of buying and selling, right? It's a transactional exchange. Now, that's not wrong. I bought some very excellent coffee this morning, and I'm glad it was for sale. But when we over apply that model, right, to things, when it comes to, when we're going to think about healthcare through a consumerist lens, a strictly consumerist lens, or childcare or housing, right, then we start to see that that really limits the policies that we take. So understanding those mental models and mindsets often can lead us to bigger, bolder ideas in how to transform a system. So, the characteristics of mindsets or mental models, and the anthropologists on staff at Frameworks have really long and boring fights about the difference between mental models and mindsets. I'm a linguist, so I don't really care. I'm just going to tell you what it matters for how you talk. So, they are, whichever one I say, I'll flip back and forth between the terms. They are deeply seated. We're not always aware that we hold that mindset. We can be, but they are often implicit. They're widely shared. They pop up again and again, whether you're in, Dubuque or Detroit. Not to say there are no differences, right, in between different groups or geographies or that sort of thing, but typically, if you're going to really call it a cultural mindset, it's fairly widely shared. It can be productive or unproductive relative to your goals. So again, it's not necessarily right or wrong. We do often bring value judgments to them, but you want to pay attention as to whether there are lots of them. And so you want to pay attention as to whether or not you're advancing the most productive model on your issue because it has a structuring effect. So that last diagram there, if kind of ping or cue up individualism, it will lead people to certain sorts of ways of thinking about something. But if you queue up contextualism, it leads people to different conclusions. So deep-seated, widely shared, multiple, productive or unproductive, and they structure the way people think. So over the dozens of social issues in the hundreds of studies across a couple of decades, we've seen at Frameworks that these foundational mental models show up on lots of social issues. Individualism, the one we're here to talk about today, the sense that causes and consequences of issues really come down to an individual. So if I'm doing well, it's because I made good choices. If I'm doing poorly, it's because I made bad choices or didn't have the right values, or maybe just not the right talent, but also the consequences. If I'm not healthy, if I'm not well, if my kid's not thriving, that's sad for me and mine, but it doesn't really affect society, right? It's an individual consequence. Often that is related to a sense of otherism. So those folks aren't doing well, their kids aren't doing well, though that's because in this us versus them mindset, right? Some people are not just different, they're less than. And who's the us and who's the them can get filled in lots of different ways. But typically the us is the group with more power and privilege in society, and the them is group with less power and privilege. And so if we think the social problems are of people's own making, and those folks over there have a lot of bad decision making, bad values going on, that can lead us also to a sense of fatalism. How am I supposed to fix structurally, right? People's choices, and those sorts of things. We can get to fatalism even if we don't buy into individualism or otherism. The sense that our problems are so big, the structure so deeply embedded, are we ever going to make it, right? And so either way, this mental model of fatalism really can lead us to either tune out from a sense of overwhelm, develop a sense of apathy, or cocoon. All right, I'm going to take care of me and mine because it's really bad and scary out there, and I'm not going to engage in making things better for the broader, for the full community, the nation, etc. So these common mindsets limit support for change. I wanted to bring up all three of these, not just individualism, because individualism really does lead into this othering mindset that is just, harmful and toxic, and it can lead to this sense of apathy or tuning out that we know is really important to. It's really detrimental to our attempts to mobilize folks for change. So, but with the right framing, this is often where people start. These mental models are, and when we're doing interviews or kind of group discussions in our research, they're the first explanations that come up. They're the ones that people nod their head, but they're not the only ones. When we push a little further or when we change the context, we also know that Americans, these are also deeply seated, widely shared, right? And can be activated through our framing. And so the idea that context matters, that what surrounds us shapes us, that the opportunities, the environments, the larger social factors really do affect people's outcomes. Americans know that too. It's just not often top of mind, and they need our framing help to pull it forward. Uh, Certainly, we are a nation characterized by a long history of us versus them. We are also a nation characterized by a long history of solidarity, and a stated ambition and uh, ongoing work towards recognition of shared humanity and human equality. So this is kind of, instead of otherism, I like to call it togetherism, but this sense of that we're in this together. And then finally, while we are a nation that has a deep sense of fatalism, as I talked about before, our problems are big. If government's supposed to be the solution, we're stuck with that problem. All that. We also have a sense that we built this system so we can build it to do the thing we want it to do, right? If the system isn't working, we can come together to redesign it. So if you take nothing else from this, we really, our framing can either continue to give oxygen to and repeat, right, and reinforce these unproductive mental models on what our world, how our world works and how we can make it better. Or we can lift up, reinforce, give these mental muscles a few more reps, right? The other ones are being reinforced daily in lots of ways. Often it falls to us as mission-driven communicators to lift these up. I'm going to dig a little bit more into individualism. I've said, what kind of my definition of it. I'm going to show you here a reel of videos from across time in our studies, across nations. I think there's some UK and Australians in here, UK folks and Australians in here. So just so you can kind of see the way this idea plays out in everyday people's thinking and talking about social issues. So this is just kind of a fast tour of real people speaking with individualism structuring their thinking. Ooh.
Tell me what you think about how we can prevent social problems.
It's up to each individual in themselves to really dictate where their lives are going to go.
Well, the person has to be willing first. the change themselves.
You can't do everything for everybody.
Then you got to believe in yourself.
It's the mind and the determination on what they want to do and whether or not they go forward.
Well, I think people have to want to help themselves first.
It still takes that individual person to want it for themselves.
Ultimately, how we pick ourselves up, and live our days is a choice in our hands.
I think some people make their lives more difficult by the decisions that they make.
I just think it's all choices. I mean, really and truly, I just think it's a choice.
So, if you haven't heard any of that before in your work in social change, you're in the wrong webinar. So I'm sure that those kinds of comments and questions feel very familiar to all of us. It's important that we have strategies to counter individualism, because those quotes that you just heard were on education, on housing, on health, on childcare, on community environments, right? So no matter what aspect of these issues, neglect, abuse, no matter which aspects of child well-being you're working on, individualism affects that sub-issue or your corner of the work. It limits public support for public responses to social problems because the solutions are seen within the individual's grasp. And there's opportunities on every corner. It's just for, folks just need to get out there and get them. And individualism contributes to blaming, shaming, bias, and stigma. There's a sense that if, well, I won't, it contributes to that. And so therefore contributes to racism, to anti-immigrant sentiment, to anti-queer bias, to misogyny and patriarchy, all those things that blame people with less power and privilege in society for the circumstances or challenges they're facing. So we need to counter this. I will say just trying to argue people out of it is not going to work. Directly rebutting those kinds of ideas, particularly if you're restating them, is often a trap that just leads us deeper into the muck. The strongest predictor of what people will believe is the number of times they have heard it. So if we are repeating individualistic ideas, we are strengthening them. Instead, we can try to take a different angle, find a different way to talk about issues so as not to reinforce them. So I've got, I think, 4 lessons on what things we can do to counter individualism. The first is just building on the point I just made, that sometimes we are inadvertently, with the best of intentions, amplifying individualism. So we can learn how to spot how individualism is creeping into our own communications. So for instance, I see often in folks, particularly working in human services, programs like TANF, SNAP, et cetera, talking about how the program is working to make folks more self-sufficient or independent or reduce dependency. This is an attempt to push back on, right, the false narrative that folks, aren't working hard, they're lazy, they're takers, not makers, and that sort of narrative. So I understand why these words, right, are in the discourse. But we've seen when you emphasize this, it really is just, this is all language that comes from that bootstraps kind of narrative, that rugged individual narrative. On the other hand, we see often a lot of cues for sympathy, and it's important that we treat our fellow humans with compassion, but that may not be our best framing intervention, right? When we try to build sympathy for struggling families, for needy families, for vulnerable children, those are some examples, right, of those cues for compassion or sympathy. What we found over time is it has at least 2 negative frame effects. One, as I mentioned, particularly when it comes to children, people often end up blaming the parents, and that is adding to a range of problematic policies and practices. But the other is every time we're making a worthiness argument, right? This family is worthy because they're struggling. This family is worthy of assistance because they're needy. We are, by definition, like implicitly making an unworthiness argument, right? Some people, right, deserve the support, others don't. So taking out these individualizing words can make a difference. Here's an example of what that might look like. So instead of talking about America's most vulnerable and underprivileged children and that they deserve comprehensive representation and all the resources possible to help them from bad stuff and move towards good stuff, we can try to, instead of trying to say these folks, like these kids are worthy of support because or they need support because things are so bad for them, we can really talk about how all of America's kids are our kids, or whatever your state, whatever is the biggest collective makes sense for your communications. And America's children are our children, and let's make sure we care for kids of all races, ethnicities, and backgrounds by supporting families as they build well-being and weather life's storms. So we can get rid of those cues for sympathy in that type of way. Another way is to think about how is the rugged individual narrative showing up in our communication. Often when we have a program participant or program participant that really just thrived and came from moved past a difficult situation into a better situation, we often want to highlight that person and often really double down on how hard they worked, how deserving they are. But again, that is really just drawing from that overarching rugged individual narrative. Often we talk about that. We're lured into telling that story, particularly when we're doing fundraising or when we're talking about ourselves as an organization. So we want to show the importance of our work in our communities. This person was struggling, but my awesome charity really helped them out, and now things are better. Well, if you're the fundraiser on the call here, or you've got a fundraiser friend, I'm here to tell you this does not work exactly the way you think it does. So we, the nonprofit Rising Ground, kind of a comprehensive social service agency in New York, partnered with us a couple years ago on a field experiment that tested the efficacy of this traditional rescue narrative versus a reframed narrative. So there was a donor acquisition campaign. They sent out 20,000 letters to people who had previously donated to one or more similar organizations. And they randomly assigned 10,000 people to get their regular letter and 10,000 people to receive a reframed letter. And we worked with them to make sure that they were of similar length, had the same statistics, same photographs. It really was a field experiment. So their traditional letter, the starter letter, looked like this. For more than 185 years, we've written a rich history of New Yorkers helping New Yorkers. So these are helping cues, charity cues, showing much how we care for each other, some of that compassion cues. We help all these worthy characteristics, these worthy sets of people with disabilities, victims of domestic violence, children with special needs. We talk about the times of need. We offer a helping hand, and we have, and our compassionate teachers show up and find a way to reach every child. So this is talking about who gets human services by naming vulnerable groups and emphasize the value of caring or compassion. And it zoomed in on later in the letter, it's not shown here, but it zooms in on the particular troubles of one young family that was at risk, a family at risk of being separated from their child because the young parent was struggling so mightily. The reframed letter took a different approach. So, we've been here for a long time. We've helped to build well-being in New York, creating a more vibrant, thriving community. So the benefits are contextual, right? Not just the causes of a problem. And since our founding in 1831, we've worked in many different ways to bring out the potential of young people and their families. Then we have the life course examples here. So this is one way to get away from that worthiness trap of saying, we work with these three very sympathetic populations, but instead tell a life course story. We work with children in the earliest stages of life, ensuring that the foundation of their well-being is sturdy. We manage residence for adults with disabilities so they can live more independently with more room. You could talk about what you might do with people in later life. We help stabilize families going through shaky times, shoring up their emotional and physical well-being. And just as a house is never built by a single individual, no one builds well-being alone. It takes a construction crew, including the types of skilled professionals that Rising Ground provides. And when life storms hit, we're there for families whose well-being is in need of repair. So lots of cues for contextualism here, right? We're here in New York, we're building a better community. It talks about not the specific situations of individual humans, but the shared context that we all have as humans, right? The life course. And this metaphor of building or constructing well-being and its follow-on metaphor of life storms, we have found that that is a metaphor that really gets people out of that kind of grit to bootstraps thinking and into it takes a village, right? And then what surrounds us shapes us. So I clearly the reframe letter did some good, or I wouldn't have gone through this trouble of telling you this whole story. We're builders outperformed we're saviors, right? So the constructing remember this is a donor acquisition campaign. The constructing well-being appeal got more than twice the number of responses than the traditional appeal. So the woe is me story, people have heard it, right? The hey, we can come together and make this better, got people's attention, got more responses. The reframed appeal elicited more mid-sized gifts of $100 to $250 as compared to the traditional appeal. People might send in 5 or 10 or 20. Dollar for dollar, the reframed appeal outperformed the traditional appeal, $3 for every $2. And plus, we know from the rigorous research behind this that the frames in that letter led people to think differently, more accurately, more expansively, more contextually about the role of nonprofits, human services, children's agencies, right, in our society. So don't tell a rescue narrative, and definitely don't tell it just because you think you have to get funding. Instead, we can find ways to point to context and just really ensuring we're talking about the factors outside the family bubble, right, that affect children's experiences and outcomes, and that we are keeping children in the context of children and the adults in their lives, right? That we're not just doubling down on the sympathetic nature of children, right? So children are a sympathetic population, but we're keeping the full family and community in the picture. So sometimes when we do that, we were trying really hard, but we end up othering when we're pointing to context. So this is the last trap, and then I'll get into some positive things that we can do. So ensuring that we're not talking about contextual factors such as racism or economic exclusion in ways that let people leave room for people to fill in the problem is with that group, right? Rather than the problem lies with society. So we want to make sure that when we are pointing to contextual factors, we're being very clear that the issue, the step is to fix the condition or to fix the system, not to fix the people. So let me show you a couple of examples. So on the left are a couple of true facts. They are every word is true, and it's my interpretation is that they're lifted up with the intent to point to social context. Black children are twice as likely to experience child welfare investigations as white children are more likely to be forcibly separated from their families. While that is true, if we are not taking active steps to prevent misinterpretation of our data, we are inviting people, basically. It's pretty sure people will fill in their own interpretation, and they'll fill it in with individualism, otherism, or fatalism. So on its own, the sentence on the left that I just read, it's able for people to interpret that that's because, right, those Black families are twice as likely to be not caring for their children appropriately, right? So we want to make sure that we are pointing to context, but in ways that point to the system, not to the people, point to what's responsible, not who's affected so much. So our child welfare system relies on vague definitions of maltreatment that spark hasty and subjective judgments, right, that leave room for racist stereotypes to influence investigations, right? And if in a system where caseworkers are overburdened, those snap judgments can really play a role. So that's pointing to changing the definition, changing the staffing structure, right? Not leaving room to assume that the problem lies with the affected group. Another similar example, same concept. Poverty can make it more challenging for families to meet their children's needs, which can be misinterpreted as neglect. It's possible to build that sentence into your framing somewhere, but if you just say that, right, then it sounds it's easy for people to assume you are being overly indulgent, right? That if those family, and that those families, if they really cared, they would figure out a way, right, to get the things their children needs. And so shifting instead that our system over polices, right, families of color or families in poverty, leading to unwarranted interventions that cause harm. So pointing to systems rather than affected groups is one way to get into contextualism. Here's a similar example where the data is stacked up in a way that really is intended to show that there's something in the system that is disproportionately affecting. This is taken from a real communication. In this case, the person is trying to make the case that Black children and that Black children in particular are at risk of death, right, from child or from abuse or neglect. But again, without pointing to the systems, it's all too easy for people to fill in not context, but blame. And so pointing to the context in a slightly different way, pointing out the social inequities that are leading to those disparate outcomes. So our policies can help to create safe, stable environments that children need to thrive, but instead the impacts of systemic racism channel serious stress into communities of color, which undermines child well-being. For instance, decades of housing discrimination, including current unfair lending practices, mean that Black families are less likely to live near good jobs and more likely to experience pressure from low wages or long commutes. Chronic stress can spark a toxic stress response, which increases the risk for depression, anxiety, and other causes of child neglect. The cascade of consequences from policy to parenting means that when we work on racial equity, we also create stronger communities and help to prevent child abuse and neglect. So we're pointing here to working on housing, working on economic opportunities, right? Really going upstream. Finally, we can frame collective action as a form of collective caregiving. So we've seen that caregiving is it's a powerful phrase, it's a powerful frame, but people tend to think of it in very narrow ways, right? So, you're caring for perhaps a family member, older or younger, right? But we've seen that connecting this almost innate human desire to care for our loved ones, but putting it in a collective action frame was really a powerful way of getting people to think about kind of all policies as children's issues. So as we were undertaking this work in partnership with Leading for Kids, we found that people can think about childcare, education, maybe other early childhood stuff, maybe parks, at libraries as children's issues, but housing, roads, the economy, right? Those sorts of things, people were less likely to connect them to children's issues. So, and we know though that ensuring that our nation's kids have what they need to do well is a collective social responsibility and it's a shared endeavor. we have to get people past narrowly, conceiving it, taking care of kids, right, as exclusively the job of individual caregivers and parents. And so we found that cultivating a sense of collective responsibility toward children, helping people see that we all have a role to play, is possible, but we have to broaden how we talk about care. Framing collective action and saying collective action is one of our forms of caregiving. We found that doing that builds public support for a whole range of child and family friendly policies. So this phrase, collective caregiving, I want to give it a boost here. And you can, if you want to learn more about this, you can find this in the resources on our website around collective caregiving. And my very brilliant colleague, Jess Moyer, who led a lot of this work, will be at the big PCA America conference, and not too far from now, sharing more about this. But let me give you a couple of examples of what it might look like. Instead of zooming in on families, we can zoom out to collective responsibility. So we often are coming, because we know parents are possibly, a key constituency for mobilizing the policies that we want to see in our advocacy, and certainly a key group that we want to involve in our programming. We're often coming to, we're really trying to connect with, right, the parents in terms of what they're experiencing. And in an interpersonal conversation, I think that's really important. In a mass communication, a public square communication, right? We want to again talk about caregiving as a civic responsibility, appeal to people in their role as a member of a civic body, not just as an individual parent or family member. So on the left, this is coming with a lot of empathy and sympathy for families. It's an enormous responsibility. There's always something new, and trying to get to context here. Well, in order to secure the best possible outcomes for their children, families depend on being able to find a good job, healthy and affordable food, and have a safe neighborhood. So there's lots here that's pointing to context. But can we amp that up a little bit more? Yes, we can. We can do it by talking about this as a civic responsibility, and being a little sharper in terms of what we do. So raising kids is an enormous responsibility, and we all play a role in collective caregiving. How would we do that? Well, we can raise our voices at town halls in support of job training programs. We can mobilize our neighbors to demand well-stocked grocery stores, and we can urge local leaders to repair sidewalks and street lights. And that's what it looks like to do our part to help every family secure the best possible outcomes for their children. So it's putting all of everyone who reads the communication, right, in the role of being a civic actor on this issue. They're part of the context now, right, because they've got a responsibility. Here's another example of talking about connecting that responsibility and that act of collective caregiving specifically to public policies. So this is about explicitly referencing public policies in relation to care. This is reminding people that collective caregiving requires social action, not just individual action. And this helps to prevent conversations from reverting to a focus on parents or other direct providers. So on the left, there's no policy context. It's true, it's important, it's an issue I hope all of us are talking about as often as possible, but it's not our strongest frame forward. So family separation is traumatic for everyone involved, most of all kids. We need to support whole families experiencing challenges so they can stay together, and every single one of us has a part to play. I would amp that up. I would take that contextualism even further by doing what's here on the right side of the frame. First, same sentence, but we all have a part to play in opposing policies, saying the word policy, that separate families and demanding more supportive policies for families. So just simply, you don't have to go deep in the weeds into, this policy or that unless the context calls for it. But the tip here is to ensure, talk about that collective caregiving and that policy is one of those forms. We need to be active on it in order to get the collective caregiving that children need. Finally, giving in our communications parents and other direct caregivers a clear role in that collective action. So often we are talking kind of about what parents are facing instead of engaging parents with, and reminding them as not just their role as parents, but as a uh, as a civic actor. So on the left, this is kind of talking, as if parents are invisible. Families in our state are facing widespread shortages in childcare, and the Children's Agenda. I just made that name up. If you work for the Children's Agenda, I'm sorry, you did not say this. Children's Agenda is calling for change through a coordinated letter writing campaign. The organization is pushing for dedicated state funding. So this has kind of families as a passive beneficiary, right, of the noble children's agenda. But how can we put parents, how can we show, right, that parents are that they have a clear role in collective caregiving? So still got the childcare shortages. What's happening now? Well, a multiracial coalition of parents is demanding that we deepen our collective commitment to care. And we've got a letter writing campaign led by parents spelling out the need for dedicated state funding. So all of these are subtle differences, but that's kind of what framing is. It's making small or subtle or relatively, seems relatively minor, often differences in how we talk about an issue, but they can lead to outsized and meaningful and lasting effects in the way people think about a topic. So, final thing before we get into a conversation, I'll just remind you that the other thing we can always do is tutor our communications intuitions with evidence. A lot of us, our spidey senses are going off all the time these days because of the chaotic and often cruel types of policies and practices and language we are seeing play out at the federal level, but in communities across the country. And we've got intuitions about how to respond, how not to respond, who will respond to the way we respond, all that sort of thing. And we should, it's important to pay attention and be thoughtful to the communications context that we find ourselves in. It is also true that we see time and again, dozens, hundreds of studies, dozens of issues, hundreds of thousands of Americans we've queried. And one thing we've learned, we are not our audience, right? My intuitions about what will work or not work, how it will land, not land, I can keep getting more educated and make more and more educated guesses, but I also know, many times my strong intuitions about what will work are not borne out by the data. So I want to encourage you to, if you've got the resources, invest those resources in communications research. If you don't have your own resources, find someone who does and beg, borrow, or steal. You can just have ours. We'll gift it. Again, we live to our nonprofit mission by sharing the research we do freely with others. So you can find us on our website, on social, and you can sign up for our newsletter to be alerted when new resources are coming out. And the fact that we are intentional and evidence-based as we're out there in the public square is so important because while there's lots of things that can go on that can change a society, but Ivan Illich in the fabulous book, Storytelling or Myth-Making, reminds us that neither revolution nor reformation can ultimately change a society. Rather, you must tell a more powerful tale, one so persuasive that it sweeps away the old myths and becomes the preferred story. I hope I've offered some ways for you to sweep away the the limitations, I guess, or the narrow view of what happens. And if we are thinking with individualism, not to say people don't have agency, not to say, your decisions don't matter, but sweeping away where it's over applied and help contextualism become a preferred story so that we can really create the context where children, families, and communities can thrive. Thank you all for making the time. I'm super excited for the best part of the conversation, which is a conversation. And so I'm going to stop sharing my slides, I guess. And Jennifer's going to moderate a discussion.
Yes, yes. Julie, thank you so much. I just have to say, I know I profoundly love Frameworks Institute and the work that you do, and Julie, our partnership over the years. So appreciative. But I just want to say your contributions to the field and to our work are so important and so valuable. I loved how you started it off with, which was the way we frame now will affect what's possible later. And I don't think we think about that enough. What we say today and how we frame the things that we do and what's important is going to affect what's possible later and how we work later. And so I really appreciated how you started that out, but also just really value your expertise and your wisdom in this space. I will say, I feel like I know a lot about frameworks just because we've hung out for a long time over the last, 15 years or so. But the amped up contextualism, brilliant. I love that. I think we stopped sort of where you showed us on the left side, but to be able to bring it to that higher level, I just think is a place we haven't gone as a field. I think we're still stuck on sort of the left side. So I love that and just encourage everyone to think about this collective caregiving as a civic responsibility. I thought that was a brilliant new piece that I've not heard much about. And so thank you for that. I want to, I think if Jim McKay is still on, Jim, I see your question in the chat, and I think it's always great to throw an example out there and let Julie sort of noodle on it in real time. And so, Julie, if you don't mind, if Jim put it in the chat, but Jim, if you want to come off mute and also just kind of give Julie some context, I think that will be helpful, but I'd love to start there with that question, if you don't mind.
Sure. Thanks so much for this. It's got, really great stuff. And so thinking about how to apply it in West Virginia, and we've built off, and I don't know if Claire Luge is on, but great work in Arizona with Prevent Child Abuse Arizona to do Lean on Me, which is kind of geared to shift from over surveillance and policing to supports. And so then as we talked about that with a lot of parents to develop our materials, we've kind of identified a core message that I put in the chat that's parenting's hard, imperfect. We do like that word imperfect to kind of be relevant. People want to help, but they don't know how. And through Lean on Me, West Virginia, we're educating how to support families through listening, empathy, affirmation, non-judgment. That's what LEAN stands for, to decrease unnecessary, inaccurate reports. Another shout out to Claire. I think a lot of when we started this, it was like, well, the over policing is malicious, and we tripped up on like even talking about disproportionality and that it was like, well, you're saying don't report or this, and so we've kind of leaned in on the word accurate, inaccurate, warranted, unwarranted, that people without knowing how to help have an over-reliance on child protective services, which then has negative consequences. But this is our core message, and I would love to get it better and enhance it. And if we're in the wrong frame, too individualistic, I mean, it's lean on me, and just thinking of me as an individual, it raises a yellow flag for me, given the rest of what you're sharing. So any thoughts? We'd love to build this out and get it better.
Thank you, Jim. Let me ask you a question before you go off mute. who is this message intended for?
It's generally an overview of the initiative, and for the most part, our training, which is done at community level, are those people who are currently mandated reporters, then that they are working with families or with children in a position of trust. So it's really those who are the source of unwarranted reports, who have this over reliance on CPS and are not recognizing that they could have a softer touch to make connection to either formal or informal supports within their community.
Right.
So
Yeah.
that's kind of our core audience for the initiative, but this is a pretty broader
Yeah.
kind of, as we start the presentation, here's what we're at.
Sure. So I think that if your audience, when and if your audience is mandated reporters and you're talking to them in their professional capacity, particularly in the context of, a training, you've got some time to kind of go through things. I don't have too many quibbles with that message, right? This is telling them what they could do instead. And you would back it up with, you don't have to call Child Protective Services. You could call 211, right? Or connect them, to the types of supports they might need. So I think for that type of purpose, it makes complete sense. If as a broad public facing message, I would want to see more explanation, right? So I know that you said this is your core message, but if this is, and so that means there's probably supporting messages, right? But backing up, giving people context, like we all want children to be in safe and stable and nurturing environments, right? Sometimes, right, economic challenges, other challenges, right, really overload parents' ability to provide care. And we've got choices at that point, right? There can be over-reporting, which ends up leading to kind of often more harm and strains the system itself. Or there could be this other way, right? And that's why West Virginia, right, has decided, as a collective, right, we can do better collective caregiving by ensuring that folks that are around children, teachers, law enforcement, mentors, coaches, right, whoever are your mandated reporters, right, that they really know the steps they can take, right, and rather than just only having that one door, that one option of calling CPS. Right. Hope that was helpful.
That's very helpful. Thank you very much.
Awesome. Thanks so much, Julie. And Jim, thank you both. Julie, a couple things I want you to sort of riff off of a little bit, which is, I think we've heard, I think I've heard the word unprecedented in the last 4 months, more than I've probably heard in my lifetime, right? So this kind of idea that we're in this unprecedented, unconventional times. And I think Nat put out some great sort of values, right? About like, it's how we sort of want to stick to the things, not necessarily the message, but the values we uphold as based on what we know from research. And so I'm just curious from your perspective, are you getting a sense in this time, sort of unconventional times, if you will, of messages that are resonating with the general public, for example, or with policymakers or with funders? Or is it just that there are specific values, if you will, that we should adhere to? So would just love your insight and wisdom on that.
So to riff on the unprecedented label for a moment, right? I think there's one risk in that is that often the types of arbitrary, cruel, unjust actions that are on highly visible display right now are absolutely precedented for lots of communities, right? That have been facing an abuse of power, abuse of state power, heightened levels of violence, bias and exclusion for a really long time. So I would take care with that word itself. But that said, Because we may be alienating or signaling, right, to communities we want to be in coalition with, right, that we kind of don't get what's been going. It can signal a certain insensitivity in certain contexts. But that said, there are a lot, it is unprecedented. Like some things really are, right? Like for the president to be doing it, or for state policy to be calling certain types of parenting that are child abuse, right? Gender affirming care is child abuse. Like, that kind of thing certainly hasn't been done recently. And so talking about those sorts of things, those kind of egregious, like it's way over the line that we've been for a while, as arbitrary, harmful, or cruel, those sorts of things. We're finding in our culture change project that people are feeling very uneasy. While democracy is not the top thing on most people's minds on a given day, there is starting to be this creeping sense of like something is different. And so helping people name that these decisions are arbitrary or self-interested or something else, and that's what an abuse of government power looks like. That kind of helping them name that is an important step in a message. What messages are resonating, what frames are resonating is really distinct based on issue to issue, and I don't know that I've got anything like super fresh on kids like that just that we've done like since the election, for instance. But in our culture change project, the sense that like the only thing that Americans can agree on right now is that the system is rigged. Who's rigging it, for whose purpose, for whose benefit, and how is where things start to fragment. But if you are working to change a system that you understand to be set up unfairly, talking about how it's being rigged and how we unrig it is really important. So for instance, let's take Medicaid, right, which is going to have, changes or cuts to Medicaid will have a dramatic effect on children and families. That Medicaid is one of the ways we came together to unrig the unfair system of private health insurance, right? And to provide health coverage to folks who can't get it through their private employer, because their private employer doesn't offer it, because it's out of reach for their job, or because they're unable to work because they're disabled or a kid. And so we came together to unrig the system, and now, right, that's at risk. That kind of putting the policy that you're fighting for in the context of it was there for a reason. It was one of the ways we're making the nation's resources available, vital resources available to the folks that are usually being excluded, is important. And showing that messages around collective power, that when enough of us come together to organize, to demand better, to raise our voices, to ask for changes, that is an antidote, right? That's a very powerful message right now. And then finally, this one, it's hard for me, Jennifer. I'm sometimes a little sassy, and it's something about helping people see a better future. So Americans are really struggling to see a better future on anything right now. It's not just you, right? It's kind of all of us. And so painting a picture of what it would look like if we supported child well-being, if we kept fully funded and expanded Head Start and other early childhood systems, like what would it look like if we did that? It would be better. Painting that positive future, a picture of that positive future is important because people are just struggling to imagine it.
And why do you feel sassy about that? That's great. That sounds like our North Star.
Oh, I mean, because it's a little woo-woo, like, and then the puppies will come out and sing rainbows.
We also love puppies.
Yeah. Okay. Well.
No, I hear you. I hear you. I think it's like that balancing hope with, right? It's the balance.
Yeah, that's what it is. Sometimes it feels a little hopey changey to me.
Exactly.
So, but you don't want to do that, but you do want to say, when we've got, I don't know, paid family leave, right? Or
Right.
this is what happens, right? Show the positive benefits of the thing you want, or if we took action, not just the doom and gloom that is upon us if we let it go, because the doom and gloom, people already know that.
That's right. That's right. And I think it leads into the fatalism, right, that you started off with early on. But I think what's important is it's what it would look like, right? We can say that, we want people to have hope for the future, and this is what we believe it looks like, right? This is what we believe we need to build in order for folks to experience that. So
Thank you. Yeah, it's not give an empty promise of hope, right? It's paint a
right.
picture of what it would look like if
Yeah.
we fixed it. Yeah.
If we did it. Yeah. Agreed.
Good. I feel much better
Awesome.
about it now. Thank you for that.
Excellent. Love it. Love it. So we have 2 questions in the chat that I'd like to ask you, and then I'll probably wrap up, even though I have several other questions, but I can ask those of you at any point in time. But the one question is, are you doing any work with African countries to introduce this? And how if you are doing some work, if you want to just speak to some of that. We have somebody in the audience who is.
Thank you. We have done some work in South Africa and Kenya, I believe. It's possible that there are other countries in Africa that we've worked in, and they're just escaping me at the moment. Typically, when we have done that, it has been on children's issues, particularly because we have a longstanding partnership with the Harvard Center on the Developing Child. They have an international program, and there are some times when they're working internationally, they're like, you know what, a framing intervention makes sense here. Like, this is something we need to work on. So you should be able to find those reports on our website. If you can't, reach out to me and I'll make sure get them to you. We also, at this point, we've done work on 6 continents, and apparently we don't need to reframe in whatever's the bottom one, Antarctica. But we've worked around the globe.
Awesome.
Yeah.
So we can send or they can go to your website and see a little bit more about the work that you've done in other countries.
I think so. I'm checking right
Excellent.
now. The next question.
Excellent.
Yeah.
So the next question, are there tools or protocols available to help field workers shift their language and documentation habits to reflect contextual thinking?
That's a really good,
yeah,
that is a really good
question. Yeah.
It is not our main expertise. I do know that our research has been used that way. So the work of Phil Fisher, who's now at the Stanford Early Childhood Center, comes to mind, where he was working with social workers, for instance, to attend to different things, particularly the quality of interactions between parents and children. Doesn't get to the contextual factors. I'm stumped. I'm going to declare myself stumped by that one. I'm sorry.
No worries. It's a great question.
It is.
I think it was Ashley that asked it. So thank you for that question. I don't think Julie has ever been stumped. So good job on that.
Yeah.
Okay. So one other thing, it's an easy question, I think. Do you have the donor acquisition study? Like, is there a study that people can have? No.
Nope. What I just said, that's it. That's what we got.
That's it. Okay.
You have, yep.
All right. And we can share your slides, I'm assuming.
Absolutely. Please do. And I will give them. I mean, you don't have them yet, but I'll give them to you and then you can give them to them.
That's awesome. That's perfect. Okay. So I'm going to wrap us up because we're getting really close here to time, or I think we're getting close here to time. 2:10, we got 2:15. So Julie, I just want to say again, thank you so much for your continued partnership and your leadership in this space. We so value our work with you, our partnership with Frameworks, and look forward to our continued partnership. And I know there's some interesting and fun things on the horizon that I'm looking forward to. I also want to say thank you to everyone who joined us today. We have our next Zooming Out series session will be held on June 16th at 2 p.m. Central. And we are going to hear from several presenters for a sneak peek into our 2025 PCA America National Conference, Strengthened by Prevention, the Power of Prevention. And so please join us for that. There's going to be some great presenters at the conference. So also please register to join us, but you'll get a sneak peek of that on June 16th at 2 p.m. Central, and more details to come out about that. If you have any questions about anything that Julie shared, or want to converse more about some framing and shifting mindsets, please reach out. We're happy to engage in those. And again, thank you so much for being here with us today.